Did you know that up to 1/3 of people taking antidepressant medications receive no benefit from it, meaning they fail to respond to the medication? Why is that, and what can you do if that's you? I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. One-third of people prescribed antidepressant medication have a failure to respond to that medication, meaning it does not work for them. Why? Why don't they respond to the medication? It could be that in those people, the paradigm with which they're being approached by their practitioner does not match the underlying physiology of that person. What do I mean? Well, antidepressant drugs, for example, selective serotonin reuptake inhibitors or SSRIs such as Prozac, are prescribed based on the hypothesis of a monoamine deficiency, meaning the raw material needed to make the neurotransmitter, in this case serotonin's raw material is tryptophan, is deficient, and so the person isn't making enough serotonin. That's the thought. So you give a selective serotonin reuptake inhibitor or SSRI drug, such as Prozac, in order to prevent or slow inhibit reuptake of serotonin in the synaptic cleft, meaning more serotonin stays in the brain longer, having an antidepressant effect. If you are someone that does not respond to that drug, then what's happening is you probably do not have a monoamine deficiency, and there's another cause to your depression, therefore the drug isn't working. And the key for you is to determine what is the underlying driver physiologically to your depression. Research is showing, especially in major depressive disorder or MDD, that the fundamental underlying issue there is not going to be a monoamine deficiency, but is actually neuroinflammation or inflammation in general. And if you don't determine the cause of that inflammation, you're not going to help the depression. Some factors that could be driving the inflammation involved in your depression that fails to respond to SSRI medications are chronic infections, or neuroautoimmunity, or systemic inflammation that is now passing into the central nervous system, or obesity. All of these things and many, many others could drive neuroinflammation. Non-neuroinflammatory causes of your depression could be nutrient deficiencies, such as being deficient in tryptophan so that you don't have the raw material for serotonin. Now, that is a monoamine deficiency, but the cause is the lack of the nutrient because of poor nutrition, not because of just an outright deficiency in the monoamine. You may also have insulin issues. Insulin helps shuttle these amino acids across the blood-brain barrier to be used to make the final product neurotransmitter. You may also have cofactor deficiencies, such as iron or B vitamins or magnesium, that are needed to make the neurotransmitters. So you may have enough of the monoamine, tryptophan, in the serotonin example, but you may be lacking iron or B vitamins that are needed along the pathway of converting tryptophan to 5-HTP to serotonin to melatonin, etc. So these are all considerations for the people who are treatment failures on the antidepressant drug side of things. You want to think about, are you getting enough nutrients that are needed in the pathway of making that monoamine? Is there any systemic inflammation present or neuroinflammation present being caused by obesity or chronic infection or autoimmunity or head trauma? And do you have insulin issues? Those are just some of the factors that play a role here, and some of the things that need to be addressed by you and your clinician in order to get the antidepressant effect that you want in your life, return your quality of life, remove the depression. And that's done by doing the detective work, finding these causes and addressing them from a lifestyle and natural perspective so that you can live a life at optimal.